Here's Dr. Jan Mensink with answers to your common medical questions.
I was just asked by a patient about bioidentical hormones, what they are and how they work. Hormones actually have a bad rap because most people have seen the advertising on the TV for hormones and then heard about all the bad things that have happened. And there are real issues with hormones if it's not done right. There are two types of hormones out there. They're the hormones that the drug companies make. They're synthetic. They're synthetic analogs of the real hormones. They're bad for you. They're expensive. They cost money, and they have all sorts of side effects, from causing cancers to heart disease to clots to strokes, you name it. But then there's something called bioidentical hormones. Bioidentical hormones are the same hormones your body makes. No drug company will make a medicine out of these because there's a simple reason. They can't patent your own bioidentical hormones. So they can't patent it, so they won't make a medicine out of it. So all these medicines have to be compounded. Compounding is expensive, all right? It usually costs between $90 to $140 a month for compounding. We do a lot of it at the practice with our pharmacy, and it's about $30 a month. Our philosophy at the practice is not to just treat you in the normal lab range, but our philosophy is to optimize your care so that you are feeling really well. That philosophy, I'll give two examples that sort of characteristically tell it all. We had a gentleman that came and saw me about 3 months ago, and he had been looking on the web and watching the TV, and he had all the classic symptoms of a low testosterone level, low T. He'd been to 3 different doctors. 2 of the doctors had ordered total testosterone, and it was normal. Total testosterone really doesn't tell you what you need to know, by the way. You need to have a free testosterone because that's the active ingredient that tells you what your true testosterone level function is. The 3rd doctor had done a free testosterone, and it was normal. And he said, you don't need anything. But what these doctors differ from us at the practice, this man came in to see us. A normal testosterone level is 3.8 to 34. His testosterone level was 3.9. The doctor said, oh, it's all okay. But they failed to realize, you see, that testosterone level of 3.8 is like an 80-year-old man. Our philosophy here is I would rather optimize that and make you like you're about a 40-year-old man, all right? Several things that are common about low testosterone for men. First of all, if you take the bioidentical testosterone, it lowers the risk of heart disease, lowers the risk of prostate cancer, lowers the risk of stroke, makes you feel better in every way. The second thing that's important with bioidentical hormones for men is if you take these, it does something very important, especially for the person that has chronic pain or is obese. In fact, most people who are overweight have low hormone values. Think of it this way. When you take testosterone, and this is true for women too, for women who correct their hormones, they get rid of their belly fat. What happens is you're exchanging belly fat for muscle. We've had patients that can't lose weight, and we correct their hormones, and all of a sudden they start losing weight. It's like magic. Now, that's not the whole answer, and I don't want to give that idea. I'll give you another example. I had a lady, a 62-year-old lady, who came to see us probably about a year ago. She had heard about hormones, and she wanted to be started on bioidentical hormones. She was doing poorly. She had to have her thyroid corrected a little bit, and we started her on hormones. I saw her about a month ago. I walked in her room. She jumped up and started hugging me and kissing me and saying, thank you, thank you. And she said something very interesting. She said, I haven't felt this good in all my life. And I'm sure that's not quite true. I'm sure when she was 20, she felt better. But the fact of the matter, she felt so good. I'll tell you another story. I had a lady come in. Her son is a practice patient. And he brought her in about 6 months ago. She's 82. She's in a wheelchair. And we saw her, and we started her on her bioidentical hormones. She came in. I saw her. Her son was with her, wheeled her in a wheelchair. She said, doctor, she said, I feel young again. She said, last Sunday night, my son put on a record that I used to dance to. And she said, I even got up and danced a little bit. He had to hold me a bit. But she said, you know what? I think you're going to walk again. Give me a few months. Now, I can't tell you that taking hormones makes you walk again, all right? But what I'm saying is if hormones are corrected, it can be like a magic to people who take them and they're corrected properly. And the neat thing is it decreases the risk of all these bad things. It makes you feel young. Now, here's the important thing with hormones. Taking bioidentical hormones doesn't make you live longer. You're going to die at the same time. You know, after andropause or menopause, you start to slowly go down and you die. But if you take the hormones, you don't live any longer, but you live better. You still die at the same time. It doesn't make you live any longer. But a lot of magic can be done for many, many people. We strongly believe in it.